Imagine a painful chronic condition that affects up to 70% of a specific population. It physically alters their anatomy, it completely disrupts their sleep, and it makes intimacy excruciating.
Right.
Now, imagine that roughly 93% of those people are just sent home from the doctor with absolutely no treatment.
Yeah.
Welcome to the medical blind spot of menopause.
It is just a staggering disparity. If we saw those numbers with almost any other anatomical issue, it would be a massive headline scandal.
Oh, absolutely.
But because this condition happens to aging women, and, well, because it involves sexual health, it just plays out quietly in doctors' offices every single day.
It really does. And welcome to this deep dive. Today, we are going to look really closely at this exact medical blind spot. We're talking about Genitourinary Syndrome of Menopause, or GSM, which a lot of people know as severe vaginal dryness and tissue atrophy. But we aren't just here to talk about the problem today. Our primary mission for this deep dive is to answer a genuinely cutting-edge medical question, which is, can intimate exosomes, these microscopic cellular messengers, actually treat these severe symptoms and regenerate tissue?
It is such a fascinating frontier of medicine. And to answer that question for you, we've pulled together a really diverse stack of sources today.
Yeah, a great stack.
We're looking at clinical position statements from the British Society of Sexual Medicine, hard data from recent clinical trials on regenerative therapies, and insights from advanced aesthetic and reconstructive surgery practices.
Right.
Like the Bioscience Institute and the work of Dr. Ali Suede.
Okay, let's unpack this. Because the gap between the millions of people suffering from this condition and the tiny fraction who actually get treatment is just mind-blowing. We're going to take you right to the edge of a hormone-free frontier of regenerative medicine that basically operates on a microscopic level.
And to truly understand why this new frontier is so necessary, we really first have to understand the sheer scale of the problem. You mentioned GSM earlier, Genitourinary Syndrome of Menopause.
Right.
That term was actually only introduced by the medical community in 2014. Before that, doctors used terms like vulvovaginal atrophy or atrophic vaginitis.
Which, honestly, they just sound terrible.
They really do.
But beyond sounding, clinical and harsh, they don't seem to capture everything that's actually happening to the patient, do they?
Exactly. The experts in the field realized those older terms were just far too narrow. They made it sound like it was, just a cosmetic issue of shrinking tissue.
Right.
Or purely a sexual dysfunction.
Right.
GSM was adopted because it better captures the full broad spectrum of the condition.
Right.
So we're not just talking about genital dryness or dyspareunia.
Which is the clinical term for pain during sex. Right.
Exactly. We're also talking about profound urinary symptoms.
Right, because the sources highlight things like urinary urgency, where you feel like you have to go right now, or, waking up multiple times a night and just suffering from recurrent urinary tract infections.
Precisely. And all of this, the dryness, the pain, the UTIs, it's all tied together by one underlying cause, which is dropping estrogen levels during and after menopause.
Wow.
The tissue in that entire pelvic region is highly, highly dependent on estrogen to stay plump, elastic, and healthy. So when the estrogen drops, the tissue essentially begins to starve.
And this brings us to the data in our sources that just, it absolutely floored me. According to the British Society of Sexual Medicine, up to 70% of postmenopausal women experience symptoms of GSM.
Yeah.
70%. But here is the kicker, and you mentioned this earlier. Only about 7% actually receive treatment.
So wild.
How does a gap that massive exist in modern medicine? It's like having a leaky roof that you just accept because, the house is getting old instead of actually fixing it.
That's a great way to put it. If we connect this to the bigger picture, the communication breakdown is definitely a two-way street, but the data heavily faults the clinical side.
Really?
Yeah, the surveys show that around 70% of healthcare professionals rarely or never even ask their patients about vaginal dryness or urinary discomfort during routine exams.
Wow. And I imagine if your doctor isn't bringing it up and you're already dealing with, the societal stigma around discussing vaginal health, you're probably just going to stay quiet.
Exactly. Only about 25% of women volunteer the information. There's this prevailing, completely outdated attitude among both patients and doctors that these symptoms are just a natural, unavoidable part of the aging process.
Like it's just your lot in life.
Right. The mentality is often, you're getting older, things change, you just have to learn to live with it.
Which brings us to the crucial so what for you listening right now. Because a lot of people might think, okay, Menopause brings hot flashes, it brings mood changes, you just ride it out and eventually your body adjusts.
And that is a very, very dangerous misconception when it comes to GSM. Unlike hot flashes or night sweats, which typically peak and then gradually fade away over time as your central nervous system gets used to the new hormone levels,
Right.
GSM is a chronic, progressive condition. It does not fade, it physically alters the tissue, and if you ignore it, it literally only gets worse.
The sources get very specific about this physical degradation, and reading it, it really makes you empathize with how agonizing this must be. We're talking about the loss of vaginal rugae. For those who might not know, what exactly are rugae and why does losing them matter so much?
So rugae are the natural accordion-like folds in the vaginal wall. They are what allow the tissue to expand and stretch comfortably.
Okay.
When you lose those folds because of the estrogen deprivation, the vaginal canal essentially becomes a smooth, rigid tube. You lose all elasticity.
And the tissue itself becomes incredibly fragile too, right?
Yes, very much so. The tissue becomes pale and it thins out dramatically. And because it's so thin, it could easily tear and bleed during intimacy.
Oh, wow.
Yeah, developing these painful microfissures. In severe, untreated cases, you can even see anatomical changes, like labial resorption.
What is that exactly?
This is where the labia minora literally shrink and retract.
Yeah.
When that happens, the urethral meatus, which is the opening to the urethra, becomes exposed and prominent.
Which I assume is what opens the door to all those recurrent UTIs because the natural anatomical barrier is just gone.
Exactly. The anatomy is fundamentally changing, the barrier is gone, and the local microbiome is completely disrupted.
Okay, so because GSM physically degrades tissue over time in such a severe way, let's look at how medicine currently attempts to stop this decay. Because understanding the tools doctors use right now really sets up why a cellular level treatment like exosomes is suddenly in such high demand.
Right.
If a patient comes in with this tissue breakdown, what is the first line of defense?
The current gold standard of care, and, we should note it is a very good one for many women, is vaginal estrogen. We're talking about localized estrogen delivered via creams, pessaries, or rings right to the vaginal tissue.
And it works well.
It is highly effective.
So how does it actually reverse the symptoms, like mechanically?
It directly replenishes those local estrogen receptors. When the tissue gets that estrogen, it thickens the epithelium, which is that surface layer of cells, and more importantly, it lowers the vaginal pH back to a healthy acidic level.
Which is crucial for fighting infections.
Yes, exactly. A lower pH allows the good bacteria, like lactobacilli, to thrive. They produce lactic acid, which keeps the bad infection-causing bacteria in check. So you restore the elasticity and you prevent the UTIs all in one go.
And importantly, the sources note that local vaginal estrogen has minimal systemic absorption. It mostly stays right where you put it, so it doesn't heavily impact the rest of the body.
That's right.
But here is the major complication, and it's something the sources really highlight. What if you can't or, simply won't take hormones? Like I have a friend who went through breast cancer, and her oncologist was very, very strict about avoiding estrogen.
Yeah, that is a very significant population. You have oncology patients who are often pushed into sudden medically induced menopause by their cancer treatments.
Right.
Because many breast cancers are hormone receptor. Positive meaning estrogen literally feeds the cancer oncologist. Absolutely forbid them from using any form of estrogen, even localized creams.
You also have women with a history of deep vein thrombosis or blood clots where hormones carry major risks. Or, quite frankly, women who just prefer a natural, non-hormonal route for their own peace of mind. If estrogen is off the table, are these women just stuck? What are their options?
Historically, for those women, the traditional non-hormonal options have been over-the-counter lubricants and moisturizers.
Like the stuff you just buy at the pharmacy.
Exactly.
Mm-hmm.
But as the British Menopause Society points out, those are rarely sufficient on their own for severe cases. A lubricant during intimacy just masks the friction temporarily. It's a Band-Aid.
Right.
It does absolutely nothing to heal the underlying atrophied tissue.
So, if moisturizers are just a Band-Aid, how do we actually heal the tissue without hormones? This is where our sources introduce energy-based interventions like laser therapies.
Yes, specifically fractional CO2 lasers and erbium.YAG lasers. Gynecologists and advanced aesthetic surgeons have been using these for a while now with actually quite a bit of success. The laser probe is applied to the vaginal walls, and it works by creating controlled microthermal damage.
Wait. I really want to make sure I understand this. They are intentionally inflicting tiny microscopic burns on the inside of the vagina.
Essentially, yes. I know it sounds completely counterintuitive, but the mechanism is fascinating. Your body responds to that thermal damage by rushing in to heal it.
Oh, I see.
The microburns stimulate the body's fibroblasts, which are the cells responsible for structural framework, to produce brand new collagen and elastin. This process increases local blood flow and ultimately thickens the vaginal wall, restoring some of that lost elasticity and moisture.
I mean, I guess it makes sense. It's kind of like how microneedling works on your face, right? Causing
Ah,
tiny injuries to force the skin to rebuild itself.
exactly the same principle.
But this raises an important question. If we are relying on lasers to burn the tissue to provoke a healing response, isn't there a better way? Like, can we trigger that exact same robust healing, that collagen production and tissue thickening, without causing thermal damage and without using synthetic hormones?
This raises an important question indeed, and the medical community has been asking the exact same thing.
Here's where it gets really interesting, because the answer to that question brings us directly to the core of our deep dive today: exosome therapy.
Yes,
To explain how this works, we need to zoom way, way in.
we do. To understand exosomes, we first need to briefly talk about stem cells, specifically mesenchymal stem cells, or MSCs. For a long time, the holy grail of regenerative medicine was transplanting live stem cells, say, harvested from fat tissue or umbilical cords, directly into damaged areas to heal them.
But according to the sources, actually using live stem cells is really complicated. The cells can die during transport, they might be rejected by the host's immune system,
Right.
and they are incredibly difficult to store. So scientists started looking closer at how stem cells actually manage to heal tissue. And it turns out the stem cells aren't necessarily doing the heavy lifting themselves, are they?
Precisely. The stem cells secrete these tiny extracellular vesicles called exosomes. To give you an idea of scale, they are incredibly small. We're talking between 30 and 150 nanometers in diameter.
So practically invisible.
Oh, absolutely. They are released into the surrounding environment, and they act as a highly sophisticated communication system between cells.
When I was reading the sources, the analogy that really made this click for me was thinking about it like a construction site. If the stem cells are the massive, clunky factories, the exosomes are the instruction manuals or the biological text messages that the factory sends out to the workers. You don't actually need to transplant the whole bulky factory to get the building built. You just need to deliver the blueprints.
That is a perfect way to visualize it, and what is inside these text messages is what makes them so profoundly powerful. According to the Bioscience Institute and the clinical literature we reviewed, these exosomes are packed with active biological cargo.
What kind of cargo?
They contain specific lipids, messenger RNA, cytokines, and proteins.
So when these exosomes are applied to aging or atrophied vaginal tissue, either topically or through minimally invasive microinjections, they don't just sit on the surface like a moisturizer. They actually enter the local cells.
They do. They're absorbed by the local vaginal cells, and they start issuing commands. They actively instruct the aging cells to behave like younger, healthier cells.
How does that actually translate to reversing GSM? What are the specific commands being sent?
The mechanism of action is multifaceted. First, the messenger RNA and cytokines stimulate the local fibroblasts to ramp up collagen and elastin synthesis.
Which restores that structural firmness, plumpness, and elasticity we were talking about losing earlier.
Exactly.
Yeah.
Second, they help regulate the local cellular environment, which can indirectly support a healthier vaginal pH. This makes the tissue more resilient against bacterial and fungal infections.
And they also fight oxidative stress, right?
Yeah.
Because the sources mentioned they transfer antioxidant molecules like SOD superoxide dismutase. Think of SOD like a biological shield, protecting the tissue from further cellular damage and the general wear and tear of aging.
Precisely. It is a comprehensive cellular level reset. But of course, theoretical biology is one thing. The real test is whether these biological text messages actually reverse GSM in a living system.
Which leads us to the clinical evidence. And I really want to dig into this because a petri dish is very different from the complex environment of the human body. Let's look at the preclinical proof, starting with the rat study published in the journal Aging.
Right. In that study, researchers essentially induced severe menopause in rats by surgically removing their ovaries. This creates that exact state of sudden, drastic estrogen deficiency that causes vaginal atrophy.
Okay.
Then they treated the atrophic vaginal tissue with exosomes derived from human umbilical cord mesenchymal stem cells. They delivered these via a hyaluronic acid hydrogel just to keep them in place.
And the results weren't just as subjective, well, the tissue looks a bit better. They were highly quantifiable under a microscope.
Very much so. They performed tissue staining and found a massive, undeniable increase in the thickness of the vaginal epithelium. But more importantly, they didn't just look at the structure. They measured specific proteins to see why it was thickening.
Right.
Specifically, they looked at a protein called Ki-67.
Which, if I understand correctly, serves as a strict biological marker for cellular division. Think of K67 as a flashing light that only turns on when a cell is actively multiplying.
Right. The exosome hydrogel massively increased Ki-67 expression. That means the exosomes were actively commanding the tissue to regenerate itself. They also saw a significant increase in CD31, which is a marker for angiogenesis.
Angiogenesis being the formation of brand new blood vessels.
Exactly. More blood vessels mean more blood flow, more oxygen, more nutrients, and ultimately healthier, more sensitive tissue.
Okay, so it works in rats. But rats are quite small. Let's move up the mammalian ladder. There's also some really compelling data from porcine models pigs out of Duke University, and this study looked at a much more extreme scenario than just dryness.
The Duke study is particularly striking. They looked at a very severe pelvic complication, vaginal mesh exposure.
Ouch!
Yeah. Sometimes, when a synthetic mesh is surgically implanted into a woman's pelvis to treat organ prolapse, the vaginal tissue overlying the mesh breaks down. The mesh literally becomes exposed inside the vaginal canal. It is agonizingly painful, it causes chronic infections, and it traditionally requires a complex secondary surgery to try and close the hole.
And anyone who has had pelvic surgery knows that going back in for a second surgery is the absolute last thing a patient wants. So what did the researchers at Duke actually do?
Instead of doing surgical closure, they tried injecting exosomes directly into the tissue surrounding these mesh exposures, and the results were remarkable.
Really?
Yeah, the exosome injections alone prompted the body to regenerate healthy, well-vascularized, ruga-rich vaginal tissue that literally grew over and covered the exposed synthetic mesh.
That is wild. They basically handed the tissue the instruction manual, and the tissue built its own biological bridge over the synthetic mesh, completely avoiding the need for surgical repair.
Exactly.
So if we know this works in complex animal models, how does this translate to human treatments right now? Because women with GSM listening to this are wondering, is this actually available?
It is rapidly entering the clinical space. For instance, advanced clinics like the Bioscience Institute detail a protocol called ExoFemale. This utilizes exosomes derived from adipose tissue, so fat-derived mesenchymal stem cells. These exosomes are thoroughly screened, tested for quality and purity, and then administered by specialists to treat the laxity, severe dryness, and reduced sensation associated with GSM and postpartum trauma.
Now, I have to push back here for a second because this all sounds almost too good to be true. You said earlier that these exosomes are actively commanding cells to divide and multiply, and they are commanding new blood vessels to grow. Isn't that exactly what cancer does?
That is a very fair point.
What is the safety profile here? Why doesn't injecting a vial of cellular commands carry a huge risk of causing tumors?
That is an incredibly important question, and it highlights exactly why exosomes are considered such a massive breakthrough over live stem cells. What's fascinating here is that exosomes are entirely cell-free. They are just the messenger vesicles.
Oh, I see.
They do not contain a nucleus, and they do not contain their own DNA.
Ah, so they can't go rogue and start replicating themselves uncontrollably.
Precisely. Because they have no DNA, they cannot form tumors. Furthermore, because they are not live cells, your body's immune system doesn't recognize them as foreign invaders. There is virtually zero risk of rejection. They are incredibly biocompatible.
And from a practical standpoint for the doctor, they must be much easier to handle than live cells.
Absolutely. Live stem cells are notoriously fragile. They require complex, expensive lab conditions just to keep them alive during transport. Exosomes, on the other hand, can be lyophilized, which is just the scientific term for freeze-dried.
So they just sit on a shelf.
Basically, yes.
Yeah.
They remain perfectly stable as a powder for storage and transport, and the clinician simply reconstitutes them with a sterile saline solution at the bedside right before application.
And because of their physical size being on the nanoscale, they can penetrate the tissue much more effectively than a bulky cell, right?
Exactly. They can easily slip between cells and penetrate deeply into the vaginal mucosa to trigger that new blood vessel growth, while simultaneously delivering anti-inflammatory cytokines that shut down the local inflammation, causing the burning and itching in GSM.
So what does this all mean? Let's bring this all together for you listening. If there is one thing you take away from this deep dive, it is this. Severe vaginal dryness, pain during intimacy, and the chronic urinary symptoms of GSM do not have to be an inevitable, silently endured part of aging.
The clinical data is crystal clear on that. Leaving it untreated allows the tissue to progressively degrade and physically alter your anatomy. We have excellent tools right now, like localized vaginal estrogen and fractional lasers, that have successfully helped millions of women regain their quality of life.
But intimate exosomes represent a massive futuristic leap forward. They offer a highly biocompatible, completely hormone-free way to literally instruct your aging tissue to regenerate itself from the inside out.
Oh,
There are no thermal burns required, no synthetic hormones to worry about if you have a mitochondrial indication, just the biological instruction manuals for cellular youth.
it truly is a paradigm shift. We are moving from simply treating or masking symptoms to actively restoring the fundamental health and architecture of the tissue itself.
Which leaves us with a truly profound question to consider. We've spent this entire time talking about using exosomes to reverse the damage of GSM after it has already caused suffering. But if these microscopic text messages can so effectively rebuild and rejuvenate vaginal tissue without hormones or surgery,
Yeah,
what does this mean for the future of preventative medicine?
that is the exact frontier we're looking at next. Could we eventually see a world where routine, localized exosome therapies are used by women in their late 30s and 40s, actively stopping tissue aging before the symptoms of menopause ever begin?
That would change everything.
It really would. We might be approaching an era where GSM isn't just treated, but becomes a completely preventable condition for the next generation.
Now that is a future worth talking about. Thank you for joining us on this deep dive. Until next time, stay curious.